problem is the following, that people like us who take decisions about sanitation think that solutions are meant for those who are dealing with the problems of open defecation every day, but these solutions need not necessarily apply to us. So the challenge is really thinking for a common solution for everyone rather than thinking of solutions for them. And we must get out of that attitude.
We know that diarrheal diseases are one of the biggest causes of death, and that over 200,000 children will die every year in India as a result of diarrhea, which typically is a sanitation problem. And so it's really not, the toilets and the use of toilets are a necessary component, but they're not sufficient to really provide sanitation. As Dr. Vijay Raghavan mentions, you really need to treat the waste.
In rural areas, people would prefer open defecation to the use of toilets. But I think there's a simple explanation for that. I may be wrong. But I think the explanation is that the quality of accessible, available toilets is so ghastly that anyone, given the choice of open defecation versus using those, would prefer open defecation. So the challenge is therefore not framing, looking for answers in current context, but demonstrating the availability of culturally integrated, socially acceptable, technologically efficient and safe toilets, and then asking the question. And I think if you frame the question in that context, which is yet to be framed in that context, we will get very different answers.
We see many indicators of progress, and we also see governments at different levels identifying sanitation as a real area to invest in, because people know that for every rupee you invest in sanitation, the return is 5 or more in terms of benefits, health, less loss of work, even improved tourism. The number of people that today don't have any toilets of any kind means that this is, frankly, the best market in the world for people who are trying to solve the sanitation problems. And India is also quite unique in terms of the local entrepreneurial power and momentum and the respect for entrepreneurs and for people that take risks and for people that try to create new industries. So I think there's so much opportunity with government paying more attention to this, and with cities thinking about how can we work in partnership with entrepreneurs to deliver services like better sanitation. I think India is a country that could really, as Dr. Vijay Raghavan said, could actually accelerate quite quickly.